how to restore a canine enamel layer after you've already done the dentine layer. Okay, so you can see that I've got the matrix in place. I have obviously had some blood and stuff, so I've had to wash everything off really profusely, do whatever you got to do to get rid of that blood, and now I am re-etching the surface just to clean the surface off, okay? You can't really aerobrave because it will just damage this matrix. So, and then we're going to, now that we've cleaned the surface with some etch, we're going to reapply self-etching primer and bond as if we're starting on a new tooth. Okay, it's just to make sure that the bond layer is nice and clean and refreshed so that you don't get stains because you had to do all that fiddling about between the last layer and this layer, and also you had blood and saliva and who knows what else. Totally fine to do this. When I graduated, I would have had a heart attack about getting that blood on the tooth, whereas now I just look at it and go, yeah, this happens all the time. So we're going to thin down the bond, and we're putting a little bit of flowable here. This is just like a wetting agent. I think there's a thing called modeling resin, which is like filled clear flowable, which is designed for this. If you're a poor person like me, then you're just going to use regular flowable instead of modeling resin. Much less street cred though. Your friends on Facebook won't like you as much if you don't use modeling resin. So if you're doing a lot of social media work, definitely use modeling resin. Super cool. Makes no difference really. So you can see I'm just doing the put a big blob of enamel shade on it technique. Okay, so there's no palatal. This is kind of like you just have a patient come in, a big deep cavity. You don't have time to do palatal shells and all that sort of stuff. And I think the results are very, very similar. And often similar for very deep and difficult restorations. So just making sure I've got enough. It's over bulked, but I really need to make sure that I have enough there. I don't want to find out that I'm short because it's harder to fix that than to fix too much. If you've got too much bulk, easy to cut back. If you don't have enough bulk, very hard to fix. So here I have the resin on. I've just put a little bit more in the buckle there. I think I hadn't covered the bevel enough, and that's really like the worst thing that you can do is you finish the restoration and you realize that you hadn't quite covered the enamel bevel enough, and then you got to start the whole thing again, and that's a recipe for sadness. So this is called no sadness technique. Now that we have the bulk done, we just cure it, and now we got to do massive, very rapid bulk reduction to the right shape. Okay, so first of all, we want to find the margin. So we're going to just use a coarse disc. And what you don't realize when you watch other people do stuff, or particularly when they take photos, is how many coarse discs they're using. So I use almost no other disc except the coarse one. So I never use medium fine or super fine, not since dental school. But I use like 1 million coarse discs. In fact, 1 million coarse discs. So here, now obviously it's a little bit hard to do around the gingival margin because the ligatures are in the way, and it is, just destroy those ligatures. Don't worry about them, and you can go back and do more polishing at this area, but it's super important to get your edges smooth. Like a join margin or something going over onto the enamel beyond where you've etched will cause staining, and having any sort of roughness at the margin will cause staining as well. So now we're just doing bulk. So getting the face flat. And you don't want to try and make it look like a tooth yet. You just want to get the right contours. So you can see now I've got overhangs there. And how do I get the overhangs off? I just use a scalpel. So it really doesn't matter. Like if you cause an overhang, you can easily get rid of them. You just use a scalpel and you can shave them off. Takes like 1 minute. Yes, it makes the tissues bleed. It's not your tissue anyway. Patient will get over it. Okay. And now we get in there, and you can see I've put my lines in there, kind of like my plane. So there's like the mesial and distal plane, and then you've got the two facial planes, which combine to give a canine shape. And with teeth, they're generally like flat with round corners. They are not round. So if you make it round and then polish it, it'll just look like crap, okay? It will look super undistinguished. It'll just look awful. So make it quite, particularly with composite resin, you have to make the tooth kind of the right shape, but chunky. And then once the tooth is the correct shape, then you polish it, and the polishing will round all of the corners. Now you can see here that I am now got a football burr in. I'm just taking all the bulk off. Don't bother trying to check the occlusion until the palate resin is flush with the enamel on one side of the cavity and the same height as the contact points on the adjacent tooth. So if you can see the adjacent marginal ridge is this height, don't have the filling like this height. You know that you're going to have them the same height. So you might as well just trim the restoration until it's the same height as the adjacent marginal ridge or palatal surface. Just cut it back. It'll still be too high, but now at least it won't be way too high. It'll just be a little bit too high. Your number 12 scalpel is your friend. Okay, you can get rid of any overhang with it on the anterior teeth and most posterior teeth. Key with embrasures, they go really deep between the teeth. It's actually hard. Sometimes you need to, you can see here I'm using a burr to try and get that palatal or that gingival margin nice and smooth. Re-curing it, because when I cured it the first time, it was not cured enough in this area. Trying to get those nice planes in place and a nice deep embrasures. If you look at the adjacent teeth, you can see embrasures go a long way in between the teeth, like nearly halfway through. The contact point is nearly halfway through the teeth. Now, at this point, take off your ligatures first. Everyone who does this will at one point leave a ligature in the tissue and the patient will come back and then there'll be massive inflammation and it's because you left the ligatures in. So always remove them first before the rubber dam. After you take the rubber dam on, the ligatures disappear under the gum and they're really hard to get out. So always take them off first. And now we're ready for polishing. Talk about that next.